Hey folks, good to have you back. Hope you were with us about a week and a half ago. Jason Harper visited the office of Dr. Sam Jirik, who is performing guided implant surgery on Sharon Prophet. Welcome to the both of you. We thought it was interesting enough that we wanted to come in and have a follow-up to this surgery. And we've got some pictures we want to share with folks to show a little bit about the procedure you went through here. And we'll take a look at those as we go along. But for folks who didn't have a chance to join us before, let's talk a little bit about what this teeth in an hour is.
Well, actually what it is a new procedure where we're utilizing computer-generated scans, CT scans, and placing the dental implants in their optimal positions in the patient's mouth before surgery. We're able to pre-plan the surgery, no guesswork, know exactly where the implants go, and then we email this to a laboratory in Sweden, and they send us back a guide which allows me to place each individual implant in that exact location.
Now, Sharon was obviously an ideal candidate for this. Now, let's go back to before you got the implants, because I know you've had the uppers and the lowers done at this point. But before this, what were your problems?
It was hard to eat. I would be sore on the bottom one. It would be sore a lot of the time because I've been using them for a long time. And then I visited Dr. Jirik, and it took 4 months back then. But it doesn't take very long at all, and it just totally changed my life because I haven't had one drop of problems since.
Really?
Not even once.
You feel very comfortable with them.
Yes.
You look comfortable. You look good. I mean, there's form and there's function. You want it to look good, but you also have to work, well too. And this is a good way to get both, right?
Absolutely correct. And we're able to rebuild the patient's mouth for years of bone loss, things of this nature. When we place dental implants, we can make dentures to the proper configurations to fill out a patient's mouth and take years off their age.
Let's do a little deconstruction of this model you've got here to show us what you're talking about, because I think it's pretty fascinating stuff.
Well, actually what we've got here is a model. This is an upper arch, of course, laying down. And we place 6 dental implants in the back, typically. And once these implants are placed, then there's a metal bar that is made that fits over the implants. This is cemented in, and this doesn't come out of the mouth.
Is this what you get back from Sweden? Is this what you send back?
Actually, no. I get back a guide which tells me where to place each one of these implants.
Okay.
And
to give you maximum support and all that. Okay.
Absolutely. And so once we get the implants placed, then we will make this bar, and we have a denture which actually has a metal casting inside of it that we can look at here, and what you see is the little clips inside the denture, little metal support structure, and the denture is set up like this, and we're able to actually clip the denture down over the model just like that.
Now, you did Sharon's uppers and lowers in 2 different procedures. Is that generally how it works?
Typically, that's how it works. We had done our lower arch first, and then we came back, and she was so happy with that, she wanted to come back and do the upper arch. And we offered the new technique, which I think she's much appreciated more than the other one.
Yeah, it was much easier.
Yeah.
Yeah.
Have you been brave? Have you gone out and tried some things maybe perhaps before that you wouldn't have attempted to eat, like ribs or corn on the cob?
Not with the top ones yet, because it's only been about a week and a half, and I'm going to let them stay with the soft stuff for a little bit. But with the bottom ones, I can eat anything at all. Yeah. It doesn't matter. I can crack nuts even. So,
really?
Yeah.
So I guess it's baby steps at first, and then later on, anything goes.
We tell our patients they have to walk before they can ride, and with Sharon's typical situation here, there are a couple different things involved with their healing process that we want her to be a little bit more careful.
Now, if folks are watching this and think perhaps they might be a candidate for this, what would you recommend they do?
Well, they can go to your website. We've got a very informative website with information about teeth in an hour or guided implant surgery. I have some articles on that. NobelSmile.tv, that is another website for the implant company that we use that has this technique, and they can get information from them as well.
Yeah, I think we have linked all that through our website, katv.com. We try to do that to simplify matters. Your office in Cabot is where?
It's Cabot, located beside Arvest Bank on Main Street.
Well, we thank you very much for coming in. Fascinating information. There's all the information you need. Sharon, thank you for coming in here and sharing your time with us.
Thank you for having us.
Before and after. I asked her what she was more uncomfortable being on TV now or before, and she said, well, I was kind of gassed before when I was on TV, so we don't do it in the studio, although we're thinking about it. We're coming back on Good Morning Arkansas, coming up right after this. Catch up with Todd Jacobian a little bit later on. He's at the Habitat for Humanity House.